pledge, please? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Good morning, everybody, and welcome for our county commission meeting, Monday, November 2nd. It seems like the county's moving faster and faster. Okay, public comment. Public comment.
Madam Chairman,
Yes.
I got my tax bill.
Identify yourself with.
Pardon?
Identify.
Oh, I'm sorry, I'm Cheryl Campbell. I got my tax bill Friday. And there are 3 new items on the tax bill that weren't there last year.
And what are they?
Emergency disaster. So I have no idea, and I went down and asked Doug about that.
And what did he say?
He said that he didn't ask about it, but that it had been approved by you guys to put emergency disaster, and he thought that it was for just additional emergencies, for some contingency.
Well, because of the fires. And before the state will kick in, we have to use our money. That's the reason that's there. Go ahead.
And then the next is economic development.
Okay?
I didn't know what that was. Doug went and asked, and he said that's, in addition to other things, he said it's membership dues for MBAC.
Okay.
Well, why are we putting MBAC's membership dues on the tax roll?
Because of all the things that MBAC does for this county.
I contend, and let me read, it's only 4 lines. No county must ever give or loan its credit in aid of or make any donation or grant by subsidy or otherwise to any individual, association, or corporation, or become a subscriber to or a shareholder in any company, corporation, joint holder with any person, company, or corporation. Membership dues make Broadwater County a subscriber to MBAC.
Would you give me that code number, please?
7-7-2103.
2103?
Mm-hmm.
Okay. I'll have Corey look at it.
So I contend that is improper in the tax bill and improper to have been being paid all these years. Because it makes us a subscriber. The last one is community development. Is that BCDC? On the bottom, it just says community development.
Yes.
And Doug wasn't sure about that, but he thought it was community, BCDC.
Yep.
It's actually Nicole.
Oh, I'm
Planning.
wrong. The
Is
planning
that-
office down in the basement. Nicole.
Oh, okay. Well,
She's
anyhow,
the
that's my
planner.
comments.
Anybody else? Kim? Joan? Okay.
Madam Chair, I just want to make just a clarification for the record.
Okay.
The Montana legislature is the one that okays counties to pay for economic development. It is required by both the federal and the state laws. In order to receive any, of course, we have to pay into it. So that's probably a federal issue Cheryl may want to take up with EDAs, Economic Development Associations, and HRDCs. So,
Thank you.
yeah, you betcha.
All right. Franklin, Montana Minute.
You know, just typical fall year, fall. Getting things done before, well, we can,
Snow's supposed to fly this week.
yeah.
Morning, Brenda. Welcome back. All right, Montana Minute.
I just want to again salute our volunteers locally. This weekend we have the American Legion with the annual Surf and Turf volunteers. We have a bunch of agencies working together with Mia on her project, volunteer. We will be starting to fill our boards again, volunteers. I just want to salute our volunteers in this community because they're the ones that make this community what it is.
They do?
Yeah.
I'm just gonna ditto what you said, because I think we're very lucky to live where we do, and people are forthcoming and willing to serve on all the different boards and projects that are going on here. Okay, community update, Franklin.
Attended the mosquito board meeting and attended the health board, or the hospital, excuse me, hospital board meeting with the lenders in Helena last Tuesday.
And what went on?
Well, maybe more confusion in a way. There were 3 different outfits there that might lend them some money. But they've got to come up with some criteria themselves, so I don't know how.
What is the status of their finances over there?
Well, from the way it sounds, broke, I guess. Well, they're gonna make payroll from different things I've heard.
Really? I mean, Laura,
Just an area of correction, I think it's really dangerous to be spreading rumors here at the commission meeting. I don't know where Commissioner Slifka gets that the hospital is in jeopardy of making payroll, but I think I have to call a really big foul on that comment. It's absolutely not true, 100% not true, and I would like to maybe ask the hospital to come and see us so that they can dispel that rumor before it takes fire and hurts our community.
good idea. Anything else to add to community update? What do you?
I went to the solid waste board meeting, and it was a good meeting. They have a good board. I also attended it was a hospital district meeting, and it was with Intercap Board of Investments. Those two, of course, work together. Intercap is underneath the Board of Investments, and what they're looking at for the hospital is a refinance, and essentially what they're trying to do is work with the hospital to lower their interest rates on loans they already have and free up CDs that they have used as collateral right now. So it's actually a good business move. LAC, that's the Local Advisory Council for Mental Health, it's also this week. I met with Morgan, with Senator Daines's office. We talked about a bunch of the issues for Broadwater County specifically, and most importantly broadband, which is on the Senator's radar. So that's good to have him as a partner on that. Number of meetings with constituents on different issues that we have in front of us, as well as opportunities. So that was really good. We'll be bringing that, they'll be bringing those forward to the commission. And I had lunch at the senior center. Their numbers are growing. They have increased from about 12 on average to 25 to 30 some days.
Oh,
Yeah, the new flooring is fantastic. They're really happy about that. That was a necessity. And they also got new table covers to help protect the flooring from spills and use and that kind of thing. They also had that day a big pinochle tournament going on. So it's well used, and they're extremely happy with the new lights.
Good.
Yeah, one person has credited those new lights with keeping her from falling. So if we save one person from falling, we'll say it's a great investment.
that's right. I also attended the mosquito board meeting, a good meeting. John Semple was there and explained what's gone on this year, where they sprayed, how much they sprayed, those kinds of things. And then Rocky Mountain Development, as y'all know, I'm on that board, met on Thursday. And it was a very good meeting, so we're working upward and onward from the stuff they've been through. And that's all.
I should mention I was also at the mosquito board meeting. I thought John
Right.
did a great job.
He did.
Yeah.
Without that talking, lost. What time do you have?
I got 10:10 here, I'll set this. If you got a watch or,
I've got to watch, I
Oh.
just didn't know if it was right
is
or
that
not.
easier to, I don't know, well, it should be pretty close, I guess.
Yeah. All right. Did you talk to this guy?
Oh, yes. He is with the mosquito district. It's Patrick who was here with the map.
Oh,
This,
okay.
he gave Doug a presentation on this, and it's something that law enforcement is using all over the state. What it is a very detailed map that can help law enforcement and EMTs know exactly where to go in an emergency, rather than them spending hours training on and memorizing where different roads are. That's just a small part of what they do. It's pretty all-encompassing, so I put that in there if you guys would like to have a presentation from him to know what it is. It's pretty reasonable. I think it's well worth our time if it can help serve our citizens.
Well,
through,
I think it'd be good to
faster.
have Wayne and Brenda both here.
I agree, absolutely, as well as Mary Mystic,
Right.
yeah.
Would
And
you-
Ed, with the fire district.
Schindel, yes. Okay. So his name is Patrick Doherty. He's a GIS specialist, works with JHS, with John Sample's group, providing digital moving maps with GPS for ambulance, EMS, law enforcement, firefighters, and DES. Another one that would be good there is, and I'm missing one.
Nicole?
No, yeah. Mike Conkey, thank
Oh,
you.
absolutely, thank you, Lynn. Yeah. Yeah, I can call all those folks if you like and set something up.
Okay.
Mhm.
And then we need to get it on the agenda.
Yeah, yeah.
And I've been back and forth with David Morton from Black Mountain, the computer company. And so they're trying to work through some problems. This letter is from Debbie with Black Mountain to Doug Ellis. On the evening of Thursday, October 22nd, we will be enabling additional security on the server hosting your data. This security is designed to prevent attempted logins from locations and addresses. Other than that, where you are currently accessing your data, the process of setting up locations for access is referred to me. As long as your current location, IP, is whitelisted, you should see no difference in the way you are connected to your data on Friday, October 23rd. After this Thursday, any new locations will need to be whitelisted before they will be able to connect to the cloud. To facilitate access management, BMS has worked with our clients to designate a user as a cloud administrator for each client. Your cloud administrator has the ability to add access for users at any time without our assistance. Also, in the event that restoration of data is requested, we will require authorization from the cloud administrator before proceeding. In the event you need your location IP address whitelisted, please contact your designated cloud administrator. Instructions are attached that will help you identify who is your cloud administrator, how to whitelist, and the possible error messages you will receive if your location needs to be whitelisted. Additionally, you may want to click here to view a short step-by-step video tutorial if you wish. Please don't hesitate to contact me if you have any questions on this new layer of security. Sincerely, Debbie Crippen. It used to be a cloud was in the sky, not holding all of our information, and now
One of the things that they're asking for us on that, Elaine, is a point person for giving access read-only to department heads for the budget. I put the request for Cordy and Brenda to both have that. Brian has it right now, and they would like a point person. So we should come up with somebody to tell them, is the point person on that? So that's why it's here. More of a managerial issue at this point than anything else.
I think it needs to be somebody that's here day in and day out.
I do too. We could work with Doug, or we could, work with some of our staff.
Okay.
Whatever you guys think we can start with.
Okay. I'll put a hold right there. Come on up, Dana. Good morning.
How you doing?
Hey, Dana?
How was your time off?
Busy? Yes.
Not long enough, huh?
Well, it's, didn't really get done what I got done what I wanted to get done, but I didn't get any fun stuff done, so, anyway,
Darn it, darn it.
yeah, well,
But I saw a picture on Facebook with a bunch of elk in the back of your pickup.
not my pickup,
Oh, wasn't it?
no,
Whose was it?
that was Paul,
Oh, okay.
Paul and Cameron. They got lucky, so.
They got into them, huh?
Yeah, there was about 200 of them walked by them, so I figured they might as well kill a couple.
Hit them out of it.
Then Klaus got one the next day, so. that worked out
Okay.
all right. So, get the kids some.
All right, what's on in your world?
Well, these guys have been working out on 437. When it rained, they went out, and they did quite a bit of grading around when it rained there a couple weeks ago, so actually got things cleaned up pretty good. And they've been working on 437, they're pulling ditches and pulling shoulders, and they got the one section from Martin Kim's, well, Jake Kim's back to Plunkett Lake done, gravelled, everything.
How's it look?
It looks good, it's real good. And they're working on that section right now from actually Lone Mountain Road to Galen Gulch, which is about, I don't know, it's ways down there,
What's it called?
mile
Yeah.
and a half.
Galen Gulch?
Yeah, yeah, that road actually comes back east to, and meets up with Schaefer Lane.
Oh, okay.
But anyway, they're working that stretch today, and they should have it pretty well done and pulled up. Hopefully they won't get too much. Well, wait. Yeah, they're working that stretch, they did from Galen Gulch also down to the Spud Cellar last week, and they got some more rain then, and then it got awful soft on them. So TJ said they just cut it off, let it dry up a little bit, and went and did some other grading and stuff, and then they came back to it. Still a little bit soft. They got one lift of gravel on it so far, but it'll be pretty good by the time they get done, and hopefully we can get everything taken care of there and prevent that road from tearing up every time you take a truck down it, so
Yeah.
anyway. Other than that, I went to that LTAC conference, of course, in Rapid City. That was good.
Was it?
Yeah, it was a good conference. Had some stuff on some drone stuff, just surveying, disaster area stuff, like floods and all that, that they show where you can take them in over and take some video of culverts and different problems up ahead, that if you couldn't get up to look at it, but, it was interesting, but, it's pretty expensive
Is it?
ordeal if you have to buy your own or whatever, but anyway, had some good motivational speakers there, had some good stuff on right away and, stuff like that, so it was good.
Good.
Other than that,
Are they through crushing there in 6 Mile? or-
they are, yeah. Yeah, they got that done, we got Lone Mountain done, and they're pulling out of there, so get them out of here, so. Anyway, other than that, I just been gone, so.
Laura, do you have anything for him?
No, I was gonna ask about the LTAP conference,
Yeah,
so I'm glad you brought that up.
yeah, no, it was good. And I got a Mackers meeting here in a couple weeks too, in Great Falls for a couple days, so. Planning meeting for next spring, so I'll be gone for a couple days then.
Franklin, do you have anything?
No, I mentioned, I didn't realize that you weren't there, I guess usually, when I
Yeah.
get these calls, and I assume you transferred on, I gotta get in the habit of just calling the shop, I guess. If I, if I,
Well,
I never really thought about you being gone.
yeah. No, and that's fine, I listened to it here just yesterday, but I ran down there on that Smith Lane this morning, and, yeah, it's rough, we're gonna get some gravel down there, we just gotta, we're busy with 437 right now, but, we'll get some down there.
Let's see, I forget what was the other one. Oh, River Road.
River Road, I've been up and down that River Road, we'll blade it, but I mean, it's,
Yeah, I was on it, well, it's been a while, that's before the rain, so maybe it's worse now since the rain, I don't know.
no, it's
But-
not, I was down just the other day.
Okay, it wasn't.
It was actually not too bad.
There's,
Got some rain in there and got it turned.
there's just those few spots that, that time get some top gravel on those, probably would be eliminate a lot of it, I suppose.
Yeah, and I think, even TJ went in there and bladed it, it's been a couple months ago now, but actually just grabbing some of that stuff from the edge and pulling it over, it holds for quite a while, it's just got a lot of rock on there.
Yeah, they can't go down any longer.
No, you just gotta grab the stuff from the edge.
Yeah.
That and then Schaefer Lane's got a few holes in it, is all we'll get it cleaned up here, we got some pretty good moisture.
And then that, hole there on Lombard, it's getting pretty big.
Yeah,
If you've
yeah,
been
I
there.
know, and I looked at that bridge there too the other day when I was down there, and that was, I could get some stuff in that, I don't know, that bridge, I don't know. I don't know what guy's gonna have to do with that whole thing there one of these days, cause I mean, them joints, it's just, they're okay in the bridge every time they look at it, cause they look at it every year, the state does.
Mhm.
And, I mean, they okay the thing every year, it's just been a couple spots where it's,
I think it's where the expansion joints, and that's why that stuff
yeah,
breaks there.
well, it is, and I don't know, would be better if they wouldn't even paved it.
Well, that's what the state guy told me one time. This is
Oh,
several years ago they were there, and he
Yeah.
says it should take this blacktop off here, he said.
Yeah, I'll tell you what, you'd be a bugger to do that right now. Just because if you dump that stuff in the river, man, I'll tell you what, they didn't like
Yeah,
that.
well, I remember I was just a kid that one time,
You were a kid one time, so?
that particular time. And that's when Tesla still had the elevator, so you know how
Oh,
cool
yeah,
that was.
yeah.
And there's a ranch out there and stuff. And of course, there's some of us young guys there, we was happy to swing a hammer or whatever. But I remember there was asphalt on there then, and the county blade come in there and they couldn't get it off. And a commissioner jumped on it, and he scraped right off, and they scraped right out of there at that time, yeah. But that's the last time, no, that's the time when just those plank went over the top. And remember how there was about 3 wide
Yeah.
running
Yeah.
plank, I always call
Yeah.
it, like the one there at Jefferson.
Yeah.
But, and then after, about a year or two afterwards, they put that decking on. It's been a long time now.
Yeah, it's been on there quite a while, it was okay, I mean, and then, of course, then it just kinda added to the weight limit. on
That's
it,
what that's
you know,
not,
and-
state guy said, he says there's just unnecessary weight with it, and it's gonna hold moisture more and stuff too.
Yeah, well, but, I don't know. One of these days. I don't know.
It's gonna have to be redecked, I'm sure.
Well, it's either that or go over them. Cause I know Jim Hone talked about that at one time,
And which bridge is this?
the old
The old bridge is watching.
Oh, okay.
I'll go back even a long time ago when they built a new one, and it was in there to take that old one out, and the contractor already set scaffolding up, and they had barricades there, and one night the barricades all got burned up, and the bridge has been open ever since. And an injunction was filed to keep it open.
Yeah, yeah. Yeah, I don't know what he's talking about, but I know it's been mentioned.
Is there a weight limit on it?
Oh, yeah. I think 7 ton or something like that.
It's basically it's just been neglected. Just needs work.
Yeah,
There's
and
no-
actually, I mean, it state, that whole street and everything through their state.
Yeah, see, they took a 287 bypass back over, so it should be up to the state.
And I don't know why we even take care of it. Cause it is state, but whatever.
Does the state ever do anything with it?
Just plow the snow is all they do through there on on the bypass.
They don't even plow the snow on the bypass.
Yeah,
When did they do that?
well, they had been. By the time they took over that 285, Radersburg Road.
See, I see them plow maybe just down, come across from the bunkhouse and plow to the edge of the bridge once in a while, but I never see them plow inside.
Yeah, of course, we had any snow, so.
Well, no.
But they did one, well, I never, was they took over that 285.
Huh?
But anyway, I guess
Then when we get snow down through there, we plow it,
Mhm.
so. Anyway, whatever. So other than that, that's about where I'm at.
Anything else for the good of the order? Franklin?
No,
All right.
No, I answered my questions before I could ask them. Thank you.
Thank you.
All right, yeah, I think we got a call on, TJ said something about Springville again was rough. I guess we gotta do that, but kinda got done up at Winston, we hauled some gravel in that bomb up through the subdivision. It was kind of rough through there, you know, I don't know, it kept washboarding on us, so just hauled a little bit of gravel up there, got that taken care of, so. I think we're pretty well done up there, I think we're pretty well done out this way, I think. What TJ was saying, because they did a bunch early, a month or so, a month and a half ago. He was out there, so. Other than that, we'll just keep plugging along here and hopefully we'll get some snow up in the mountains and some rain here.
Yeah. We're all crossing our fingers.
Yeah. All right.
Thanks,
Thank
Dana.
you, Dave.
Have a good day.
You too.
You too. Come on down, Brenda. Come on up, whatever.
Oh, did I mention one more thing?
Sure.
My guys were asking about this longevity thing again. Anybody done anything with that? Anybody look into that? Has anything been decided or?
nothing been decided, it was looked into some, but just nothing at this point.
All right.
Commissioner Slivka tabled it from discussion maybe 2 months ago, 6 weeks ago. I'd like to request, Madam Chair, that we bring it up again for discussion so that our employees know where they stand and we can end this limbo you guys have all been in for, what, a year and a half now.
Yeah.
Well,
I think you deserve an answer.
The only thing I'm gonna tell you is that they've, I see some stuff laying on their desk and they will be coming, so. Anyway,
Thank you, Dana.
all right.
Welcome back. How are you feeling?
Good.
You went well this time?
So far.
Okay, what's going on in your world?
Well, since we talked last, previously, the open positions have been filled. So dispatch, hired a new control officer, and then detention, hired 2 new detention officers. They all 3 start today. We also had another detention officer resign, but through the pool, they were able to fill his position also. So,
Lots of new
we're-
faces.
Yeah, we're at full staff, but a lot of training going on and a lot of new faces. So,
Oh, good.
search and rescue, picked up the sleds, so we can prepare for the hunting and snowmobile seasons this year. They went on a search for a lost jogger out of Jefferson County. She was found, she took her own path evidently, ended life. And 2 missing teenagers, which were quickly located. They just didn't keep good communication with their parents is what it boiled down to. So they weren't really lost, they knew right where they were at.
Where they were
But the
going?
parents didn't, so. For detention this month, still, we've had a lot of transports with dentists and picking people up. But you're gonna have that with the numbers we've got. Average population again is about 40 to 50, currently at 44, we've got 8 of our own.
It's amazing.
Yeah.
And I was talking to Susan, a commissioner from Helena, at Rocky the other day. They don't think there's any way that their bond issue will pass.
You never know, we hope.
We hope for the best, but
Dispatch, we're still in the process of installing that new 911 system. Our old one is still working and up and going, but they hit a couple bumps with the phone system, so we had to come in and revamp them. But they're there today, and hopefully we'll get that completed today. So, as far as deputies, we're still working a lot of cases, in and out of the city and throughout the county. So, we've also been working to adopt the remainder of the horses that we can do so with. We'll still have 8 left after everything's adopted out.
No, those ones belong, the 8 that are left belong to Darlene
Yep, dating.
Daly.
So we'll have to wait till her end of the case is finalized.
When is that scheduled for? Do you remember?
Beginning of next month, I think. I read it.
It'd be good to get rid of them.
Yeah. So Dusty had 3 people out over the weekend looking at them, at 3 of them, so hopefully get rid of 3.
Are they all broke?
No. Not all of them are even rideable,
Oh, really?
yeah.
Basically canners, the way the
Drag
bush
a
workers
tank,
are.
son?
That's what I,
Or pasture pets or pasture
yeah,
babies,
I mean, just,
yeah. So, some of them, you know, you just can't ride because of injuries, old injuries, stuff like that, but
Hey Brenda, how many are left at this time?
15.
15?
yeah,
And that includes Dalene's 8?
yes.
Does she have any way of being able to pay for what it's cost to take care of her horses?
That I don't know.
She's getting off scot-free right now.
Right now, but it all comes around.
Mm-hmm.
And I looked up the cases, for the past month, we had roughly 6 disorderlies, 5 either domestic or simple assaults, mostly domestics. We had 4 drug cases last month, 3 thefts, criminal mischief and vandalism, 5, which I know they've solved with some of the young people, and hopefully that number will go down. And as far as, we were busy last month with the coroner, we had 4, so all bang, 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 bang. Plus the other ones that I think we had 3 over here at the hospital.
In listening to the news this weekend, my heart went out to Mickey Nelson. I think he had 3 in one day.
Yeah, they're busy up there.
I mean,
And he just got a deputy, I think, 2 years ago.
oh, did he?
Yeah.
Well, that's a lot in one day.
Yeah.
Thank you for bringing that in like that. It gives us a better idea of
Well, and it-
what's
it
going
just-
on.
You know, so I don't forget something.
It's good for you to be able to see it like that, but it's good for us to know and understand. Anything else?
No, I worked, or met with Debbie and discussed or I had questions on my budget, so she's supposed to get back with me on that. But other than that, no, not for me, of course, I was out there for a little bit, so.
Well, they continued on.
Yeah, no, they did great. Can't ask for anything better.
No, not at all. Well, thank you,
Mhm.
and welcome back.
Good to be back.
Thanks, Brenda.
An email from Corey Swanson. Commissioners, can you put me with the Teamster Collective Bargaining Agreement and Teamster Trust Health Insurance on the agenda for an upcoming meeting? We have finished negotiation with the Teamster Union and are ready for Commissioner approval. Also, there is a change to the Teamster Trust Health Insurance requirements, and we need to have that discussion. I request that you notice it as follows. BCSO collective bargaining agreement renewal, discussion and decision. Teamster Trust Health Insurance requirements, discussion. I recommend a later meeting with the Teamster Trust Insurance requirements decision. I can attend on Wednesday the 21st or Monday the 26th if the discussion is brief. I have a trial from October 27th to the 29th. I guess the date on this was 6/8, so I can only devote about 30 minutes. So we need to put it on the agenda. You got the agenda book?
Oh, here it is. Sorry, Ann.
So I'm gonna schedule these on the 9th of November. Does that meet with everybody else?
That's right.
Looks like a real slow day right now. So can we do the discussion and just follow it with decision, can't we?
You could even just do dash decision, because it's already gonna be a discussion since it's on the agenda.
Have either one of you talked to Corey on what the Teamsters are wanting on this insurance?
Mm.
No. That's something the insurance committee will need to be involved in as well.
Yes.
Thursday would be on the 9th.
1:30? And I think we can just put one after the other. If I put them every 15 minutes, I think.
Yeah.
This is from MDT, Montana Department of Transportation. To all city, county planners, road supervisors, public works director. Subject, local projects on designated state and federal highways. State law requires the Transportation Commission let all projects on designated state and federal highways, and it quotes what code it is, this applies even if MDT is not funding the project. The purpose of this statute is to ensure the safety of our system, that improvements are not contrary to the department's standards and will not conflict with any future plan development by the department. Once a year, we ask your local projects and we ask about your local projects and take the relevant projects to the commission. The commission then takes the action to delegate authority to local agencies. Please let us know by November 27th about any construction projects, pavement preservation activities, and/or maintenance activities you are planning on state and federal highways over the next year. You can use the enclosed local project report form. This form can be accessed online at this website. Each project must include the following information: location, scope of work, estimated cost, and year to be let. Details regarding public involvement associated with the project. I have enclosed a map to help you identify designated state and federal routes. These routes show up as red, blue, green, and orange lines. If you don't plan any projects on these routes over the next year, you do not need to submit a report. We appreciate all your help. If you have any questions or would like a copy of the guidelines, please contact Dave and Carol Strizich, Supervisor, Statewide Urban Planning. So the work that they're doing on 437, does that count?
That part is the state though, is it?
Yeah,
Doesn't the state just have the paved part?
no. They've got all of 437,
They do.
but they won't maintain it.
Right, yeah, okay.
Yeah. Get this to Dana. Would you put that in Dana's box, please? This is from MBAC. Dear Elaine, Laura, and Franklin, enclosed are the Montana Business Assistance Connection, Inc. reports for the quarter ending September 30th, 2015 for Broadwater County Revolving Loan Fund. There are no new loans originated during that quarter, and all existing loans are current and performing as agreed. Please review the enclosed information and let me know if you have any questions. I can be reached at 447-1513. I hope that things are going well, and we appreciate your continued support of our economic and community development activities. Best regards, Mark Minke, Loan Officer.
And also, for the record, so that it's under,
I think so. Pardon?
for the record, so it's understood, you, per federal and state regulations, regulating HRDCs, you have to have an HRDC to have a revolving loan fund. When you look at what this revolving loan fund has done to help businesses locally in the 20 or so years since it's been going, it's hard to discount that as a, you know, if you have the health of the community in mind. So it is, again, it goes back to the HRDCs and federal and state regulations. You cannot have an HRDC working for your county if you don't have representation. So,
Mm-hmm.
okay.
Tim?
Madam Chair, question, Tim Ravendall. In Broadwater County, the revolving loan fund has been used as Commissioner over related to helping businesses get started, et cetera, moving forward. Do we have in Broadwater County a listing of any defaulted loans in that program?
There are no defaulter.
No? Okay.
On this, they just said
Okay.
this.
I was just curious if we were on top of anything on that. Because one example of why I asked the question is if I remember correctly, PM Manufacturing was part of that program, initially to get the new building constructed out on the highway out there.
But they're
And now
not
they're
even listed.
not in business anymore, and,
But they're not even listed, so it's obviously paid off.
okay. Again, I just a curiosity question.
Not a problem. And
Thank
it's
you.
worked really, whoops, I'm sorry, go ahead.
Thank you.
It seems like it has worked very well for some people to give them a boost up.
Turned off the other one.
I have claims in the amount of $139,192.80.
Move to pay the approved claims in said amount.
I'll second.
Moved and seconded that pay claims in the amount of $139,192.80. All in favor say aye.
Aye.
Opposed, the same. Motion carried. Can I see these?
I already did.
Oh, okay.
I can give them to Ann, though, to put in her pile.
Okay.
Thank you. Elaine, that is homework I was tasked with last week, and I have an email back from Charlie. Basically, that is nothing for us to worry about. He's been working with the engineer. I don't think you have anything to worry about. I know the engineer from Northwestern Energy, and we've worked together in the past. Vernon is quite willing to work out any issues should they arise. The issue is because they're wanting to attach what they're doing to channel 13, any of the channels on either side of that need to be advised. Well, we have 10 and 12. 10 and 12, however, have changed through the sale of the Great Falls channel and the Helena channels. So that's one of the reasons we have glitches in the service of those two channels. And also they'll be able to actually combine onto one. So this shouldn't be an issue. If it becomes one, Charlie is certainly willing to work with us and Vernon. And if you want, I can provide, I just got this at the beginning of the meeting today, so I didn't have a chance to print it out. But I will print it out and put it with those for our records, and then we can keep those on file in the commissioner's office.
Okay.
So we don't have anything we need to do.
Okay. And is everybody here, is there anything happening with, that we should know about with TV stuff?
Just channels 10 and 12. And hopefully as soon as everything is solidified with that sale, we'll start getting that service back.
Okay, Franklin? Okay, I have commission meeting minutes from October 26th.
Move to approve as submitted, and again, they were emailed earlier this week.
Are you gonna second? I'll second. We have commission meeting minutes, October 26th, have been moved and seconded. All in favor say aye.
Aye.
Opposed the same.
No.
Maurice Franklin is a no.
Thank you. Thanks, Ann.
Yeah, 5 minutes. I think we'll stand at ease for 5 minutes while,
Can we actually talk about some
you bet.
commission issues? We had some homework put to us by HR, Michelle, for the policies. It looks like those are about ready to go, so I guess I was asking one, if we could go ahead and put those on the agenda. But also the two questions that we need to discuss and decide on is VIVA, which is the volunteer employment benefit that we discussed. That's the one that's optional. And then also how we're gonna handle the time cards.
Okay,
Viva, we got, and you guys, of course, are both privy to the emails. We got a response from both Brian Hopkins, legal counsel at Mako, and Harold Blatty, the executive director, on Viva,
what does VIVA stand for?
volunteer employee benefit something. I'm not sure what I didn't bring my policies with me, but I'm not sure what it
I got
stands for.
mine here.
Oh, good. It's page 56, don't quote me, but basically what it is a savings plan for unused sick leave, up to a certain amount, 240 hours if memory serves. It's totally optional. If we want to do it, there's some resources that were in that email, and some cautions as well. So what my thought on it was, and there's a table of contents at the beginning too, which should take you to Viva, would be under employee benefits, I'm sure. But anyway, my thinking is that we should leave it as is for now, take some time to research it, and get the policies adopted. You can always revisit that one issue.
I'm not seeing it, but I must be looking right at it. Okay, how much time do we need to be on the agenda?
I would think that it could be maybe half an hour tops. We should invite all the department heads, the employees that want to come and listen in, certainly are welcome. And then Michelle wants to do a training on policies so that all employees are aware of what their rights are and what the contract is with them.
In other words, all the department heads can comment on this
Mhm.
policy.
Can and should.
Yeah,
And that's kind of why I'd like to have them all invited. I think that they should not only be aware that it's on the agenda for all to see, but also should have a personal invite.
mhm. I think we're waiting on Shelley Murphy from Mako.
Yeah, yeah. So time cards, did you guys think at all about how we need to handle that?
What's Michelle's recommendation on that?
That we review them and sign them. The only thing is she left it to us to figure out what the mechanism looks like. It shouldn't be just one of us, and it shouldn't be just one of us with select employees. We should all have a hand in reviewing and signing those time cards, even if just one of us signs. The next pay schedule ends on Friday. So,
They'd all be in by Friday,
right.
so next Monday we can do that.
We could, most certainly. I would suggest if we do that, which is fine by me if we do it as a team, that we do it before the commission meeting so that we can get those to payroll ASAP so they can get started on their part. Like a 9:30. And then do you guys wanna kinda see how that goes and plan to either continue it or revamp if it doesn't work?
I'd like to see it at a commission meeting, all three of us look at an initial,
Yeah, I like that. Okay.
because then they can't say, well, for whatever reason, you know.
Mm-hmm.
What do you
Haven't
think,
heard
Franklin?
anything from Franklin.
I guess we could try it one time, see what it looks like.
Okay, so we'll try it next, at the end of this pay period.
Right. That's all I have.
Okay. Franklin, do you have anything more to add? Shelley? My printer, for whatever reason, believes the last page be first on the top, so they're all backwards.
Yeah, I don't either. Since it's only just a few minutes, I do it. Yeah.
How are you?
Good, how are you? Come on down.
Good. Good to see you all.
You too.
How are you folks?
Hi, Michelle.
Any hot seat?
Either one.
How's the Monday treating you?
Nice.
Monday.
It's a pretty sunrise this morning.
Was it?
Yeah.
And they're calling for 2 inches of snow tonight. I don't know if I'm ready for that.
Broadwater County wasn't listed though.
What's that?
Broadwater County wasn't listed in their 2 inches of snow.
Well,
Good.
Lewis Clark is, dang it.
So are you Shelley, the Braille Racer?
Yes, I am. There you are. Sometimes they're Elixir.
And a daughter that's doing well.
She is, yeah. She's just finishing up. She'll graduate in the spring from MSU with a civil engineering degree. So
Whoa.
we were there Saturday to visit her, and I said, what are you gonna do this summer? She said, oh, I probably should go to get a real job instead of just rodeo, and I don't know what she's gonna do.
Oh,
It's kind of scary, but fun at the same time.
yeah, yeah.
Yes, they grow up. That happens. Good. Well, thank you for having me. I wanted to stop over and visit and see how Broadwater County was doing, if there was anything that the Healthcare Trust might be of assistance for you for. What I handed out is just a general information packet that shows who we are, what we do. Obviously, I know most of you, and we've had the conversation about who we are and what we do, but there's some information in there for you that talks about all of our healthcare plans in this benefit summary. There's also a dental and vision benefit summary for you, life insurance, and general marketing information. And then I also wanted to touch base and see how things were coming with your healthcare reform reporting and where you were at with that, if you've had any chance to look into that, or who's gonna be taking care of it, the reporting aspect.
Debbie, Madam Chair, if I may,
Yes, please.
Debbie Kelly is doing that. And we attended, she and I, the training in Lewistown.
Oh, good, okay.
Boy, a year ago, 9 months ago, when was that? You were there.
Yeah, that's been about a year ago.
Okay, yeah. She's been keeping up on it. She has a contact at Teamsters
Okay,
who will be helping her at this point.
good.
Yeah. It's still very scary, trying to make sure that we're up on everything. And there's a lot of little pieces floating around out there, and yeah, I think we're all a little bit nervous.
Yes.
Yeah.
Very. When the actual reports and forms have to be filled out, it'll be
Yeah.
nerve-wracking. Did we
Yeah.
do it right? Did we report everything correctly?
Yeah.
Good, okay. Well, we do have another training coming up in Great Falls next week, if anyone was interested in attending, and that is for not just the Healthcare Trust counties, but any county that's associated with MACO is welcome to attend. It will be at the Holiday Inn. There are a few new updates, but nothing major that changes, so it'll be the same setup as Lewistown, where we go through line by line for the forms and which groups need to report on which forms and what have you. So if interested, you're more than welcome to get on our Healthcare Trust website and register for that as well.
And with all the moving pieces out there, I would really appreciate it if you both would attend, just because Debbie will catch some, I'll catch some, and with all the pieces out there, it's very possible she and I may miss some. So if we have two more eyes educated and looking, I think it would be a huge benefit to the county.
When is this, Shelley?
It is next Tuesday, the 10th. And I believe it's going to start, I want to say 9 a.m., so it does allow for travel time if you're in a closer county. But we do also have a room block at the Holiday Inn underneath the MACO. Room block is the name of it, if you were interested in going up the night before. And we plan to be done by about 3 o'clock, so again, people can travel home and,
Is lunch provided, or do we have to plan?
it's lunch on your own. We will have snacks, coffee and morning snacks, and then probably some cookies and snacks in the afternoon, but lunch is on your own. And we allowed for an hour and a half lunchtime in there as well. And then we'll have handouts, and it's a really good opportunity to learn about it, but also because other counties are attending, the one thing that I really like about them is other counties probably have a lot of the same questions. And so it's a really good opportunity to bounce ideas and questions and thoughts on how people are doing things or how other counties are making things happen during that time. So it's a really, really good training opportunity. There are also some webinars that will be coming up that Allegiance holds on our behalf for us and their other clients. I personally have attended both. I feel you get a lot more out of the actual class because you're there in person and you have the handouts and the paperwork and what have you. So it should be a really good opportunity to listen and learn and ask questions.
Good.
Yeah, and I do know a few of the software companies. What software company does Broadwater County
Black Mountain.
Black Mountain. So I know Black Mountain, actually took a tour of it about 3 weeks ago, just came out with a software update that attaches to your HR module, and it will actually import HR and payroll records into those forms that are needed to report. There's still a little bit of manual for each form. I believe it's lines 15 A, B, and C, or 14 A, B, and C, but it does help. And I've had a couple of counties already starting to work through that module and seeing that it's working pretty good. So I do know that's available through Black Mountain as well to help the process.
Fantastic.
Yeah.
When is the next report have to be in?
So, individual reports are required to be mailed. We suggest sending them out along with their W-2s to all of your employees by January 31st. And then the reporting forms for each eligible dependent, spouse, and your employee have to be turned into the IRS no later than March 31st. So there's 2 different forms for each employee that have to be filled out. So we still have just a little bit of time, but with all the changes and getting used to things, we do have counties that are already working through it, trying to prepare to make sure that they're on task for that January 31st
And that makes sense.
date. Yeah, it's scary and there's so much. How many eligible employees do you have here at Brightwater County? Do you know?
I think we're at 60-some, 61.
61.
Don't quote me. No, it's just over 50, 51,
Okay,
somewhere in
so
there.
you're right close to that cutoff spot where you are considered an applicable large employer. Technically, for 2015, you wouldn't have to report as such, because right now the IRS regulations are 100 or more employees. However, starting in 2016, you will have to report if you are 50 or more employees. So MACO has taken the position that if you are going to have to report starting in 2016, we recommend you start reporting now so that we work out the bugs and just is easier that way. So you're right on the cusp there. And if your employee count ever changes and drops down below 50, there's a whole lot less paperwork. There's still filing that has to be done, but until that happens or if that ever.
So are those forms going to the IRS?
Mhm. Yeah, you'll send one individually to each employee and then one to the IRS for that employee and any dependents they have on the plan as well. Yeah.
What about employees that are not on the health insurance?
So you still have to actually report, you just report that they chose not to take your plan. So you'll still have to do paperwork for them, both to them and to the IRS, but you'll indicate that they did not take the plan. So, and I'm assuming then that's how the IRS would go back and audit the individuals to make sure that they have other coverage elsewhere. If they're covered on another plan, then that employer would be reporting to the IRS for their employee and dependents, so I think it's gonna take a lot of work on their end too, but that's supposedly how it's all going to happen. So yeah, even any eligible you'll have to report for.
Yeah, and I wonder if you would even be eligible with the 26 hours, since it's 30 by the ACA,
So
is that
that
right?
30 hours, yep, is now the new full-time, according to the Healthcare Reform Act. It would, you as a county have the ability to state your own eligibility or define your own eligibility. So if currently you allow part-time employees 20 hours a week to participate in your insurance, you would have to report for them. If you're 30 hours a week or more to be eligible, then you report for your 30-hour-a-week employees. What does your current benefits policy or your employee policy state in order to be eligible for benefits?
32.
32.
So we'll have to change that to 30, right?
Yeah, 30 hours a week, and then theoretically, that mandate was back to July 1st of 2015. So if you change your employment policy, and you'd wanna get with the Teamsters on this, you could theoretically have to backdate anybody that didn't meet that, and it adversely affected them, backdate them to 7/1 and take them off the plan. However, if it includes somebody, maybe somebody wasn't working the 32 hours a week and is working 30, and it now includes them, same thing, you would have to backdate their coverage back to 7/1. So, definitely something to keep on the forefront as well.
Okay, I'm retired from the state, and I stayed with their insurance.
Oh, okay,
So are they gonna report me?
they will. The state will send, they should be sending you a, I think it'll be a 1095C, or B to you, and then report for you to the IRS as well.
You know, and it's costing me money, but I've had lots of surgeries when I was at the state. And I don't think would be fair of me to say, okay, thanks. Even though I paid into it, I just,
Yeah. Can you pay into that? Yeah, so they would report you, and then, like with our counties, and another thing that, Laura, if you're helping Debbie through that, maybe make sure that the Teamsters is going to send you a census for your dependents. One thing that's required on the reporting forms are social security numbers for dependents, and a lot of times, we as a county don't have the children's social security numbers on file, so that's something that the Teamsters will probably supply you with. I'm sure they're on top of it as well, but you'll need a census for that. And then, do they handle your retirees that are on Broadwater counties? Do you allow them to stay on? So same thing for the retirees there too.
Okay, all right.
To send a census so you have that information. Okay, so other than that, everything going good? Health insurance is good, dental vision, everything?
We don't know yet. We're waiting to find out.
Oh,
So, we have a health insurance committee,
okay,
and I would really like to give this to them,
okay,
have them look it over and put their opinions together for us.
okay. I'll give you an extra copy, and then
Thank
I've got
you.
more out in the car as well.
Okay.
How many people are on your insurance team?
6 or 7?
Why don't I get you,
Okay,
maybe 10 copies of that information, and then you
that'd
can
be
get that.
perfect.
Okay.
Thank you.
Yeah. And are you a January 1st renewal or July 1st renewal? When does your insurance start over?
July.
July 1st. Okay. And would you like me to be present at your insurance committee meeting when you go over that information?
If you're available, that'd be great.
Okay.
Okay.
So will you just communicate with me and let me know when that is?
You bet.
And then I can go over any questions they might have about our policies and what we have to offer. I'd be more than happy.
Yeah,
Okay.
absolutely. It'll probably be Debbie Kelly
Okay,
emailing or calling you. She's the chairman of
perfect.
that committee.
Okay. I will just touch base with her and ask her to include me in on the date when they decide when they're going to meet. Okay,
That'd be perfect.
okay. Perfect. All right, well, we'd love to have you at the seminar next week, if you can attend.
We have to call in and reserve in advance.
I will send the link do you want me to send it to Debbie? I'll send the registration link, and then she can forward it to you. You can just go online and register. It's not required, we just like a head count, so we have enough material, presentation material prepared, and then snacks and whatnot as well.
Okay.
So if I know that you're coming, I can add you to the list as well, but I'll still send the reservation link.
And we're requesting that the roads be dry and bare.
I'm hoping it's good weather. I know,
It's that time of year.
I
We don't know.
know, and the weather has been absolutely wonderful, and I scheduled travel for this week. I'm supposed to go to Superior tomorrow, and it's 2 inches of snow in a winter advisory, and I'm thinking, oh. So we'll see.
But
And
you've got interstate, you can share the way.
yes, just have to go up over Mac Pass, which we all know is not fun. And of course, when you're planning your travel, we plan for a 9 a.m. meeting, I don't mind leaving early, but then if the roads are bad, so. And then Powell County, Wednesday and Thursday, so Mac Pass all 3 days. Timing that good with the weather, so, yeah.
So how many counties do you have now?
That's a great question, thank you. We currently have 26 counties participating, and I have been a busy little bee. We just recently signed Powell County effective 1/1 for dental and vision, and Sanders County as well is coming on effective 1/1 for dental and vision. We are currently working with Jefferson County and Sanders County both to prepare a medical proposal for them. And we are also working with Ravalli County. I've got all of their data, so we're working with Ravalli County for a 1/1 effective date as well. So the trust is really doing well. We're growing leaps and bounds. I probably have to slow down a little bit because I'm going to be overwhelmed shortly with all of this new groups coming on. But we are doing really well, and I'm excited for what's coming, I think.
So some of those counties that you just named, just for dental and vision, is that all? Or do they have the health insurance?
So, though Powell and Sanders both are currently in a contract with Joint Powers Trust for their medical, but their contracts are up for renewal. So we are looking at, Sanders County is asking for a medical proposal. They are coming on effective 1/1 with dental and vision, as they currently don't offer a dental or vision plan, and they are interested in offering ours. So that is something that we can do, as well as offer a standalone dental and vision plan to counties, even if you're not in the healthcare part of it. So that is what they're doing. Both Powell and Sanders are coming on for dental and vision. And then Jefferson and Sanders are asking for medical proposals as well. So we'll look at them and hopefully be able to bring them into the trust. Those will be effective 7/1, but starting early with holidays and gathering the data usually takes a little bit of time, so.
Tell me about your vision and your dental.
So our vision and dental plan is super easy. We don't have any participating networks. You can go to whomever you want to see. The benefits pay the same. Our vision plan for employee only is $10 a month, so it's $120 a year. You get $270 worth of benefits, $200 towards the cost of hardware, and $70 towards the cost of an exam. Again, you can use that at any provider you want to go see. We don't have any networks that way. We are looking at enhancing our vision plan effective 7/1 of next year, so I do look for that benefit to increase. It will never decrease, but we're enhancing it, so I'm excited to see the changes there. And we also pay for prescription sunglasses on that plan, so very simple. Our dental plan, it is about $34 a month for employee only. It's $1,500 worth of benefits per year, so that means we'll pay up to $1,500 a year. We pay 100% of any diagnostic and preventative services. We pay 80%, you would pay 20% for what we consider to be type B services or routine basic care. That's gonna be extractions, fillings, periodontal type work. And then type C services, which is our major restorative, mainly crowns, bridges, and dentures. We pay 50%, you pay 50%. Again, up to $1,500 a year. There is a small $25 deductible per person on the dental plan, no deductible on the vision. Also, with the dental plan, we offer a $1,000 lifetime benefit for orthodontia if you have dependents under the age of 19 on that plan. So, and again, no provider networks on that either, so you can go to whomever you choose and the benefits pay the same.
1,500 doesn't go very darn far.
It doesn't with dental. It really doesn't. And so when we do have members on the plan that are looking at major dental work, I try to work it out so that they can get half of their, or they get their whole $1,500, schedule your benefit about the time that your plan is going to renew. So if you use $1,500, let's say the end of June, and then July 1st you renew, you get a new $1,500, and so essentially you have $3,000 right there if you time the procedures correctly. So, yeah, and that's fairly in line with a lot of the other standalone dental plans. $1,250 to $2,000 is kind of the marketplace norm as far as what is the maximum amount paid per year for dental benefits. So, and we may look at enhancing that too if we get a lot of member requests on that. That's how we do add benefits to our plan or change things to our plan, because we're a trust. We have that ability to go in and rewrite our plans and enhance benefits, and a lot of times we do that based on member requests. Our road department and sheriff departments, we're asking for prescription sunglasses, so typically on vision plans, prescription sunglasses are not covered. That came in as a request. We decided it would benefit a lot of our members, so we added that to it. So again, those are things that we can definitely always take a look at and increase benefits.
I've spent lots of time in dental chairs.
You have beautiful teeth.
Well, thank you.
It shows, right?
Absolutely.
Yeah, I'm the filling guru. I don't know how, but I have a lot of fillings. So, great.
So I was, and that's what made me know that 1,500
I know it doesn't
doesn't
go,
do it.
it doesn't go very far. Diagnostic preventative would pay those at 100%, but if you have major work, a crown nowadays I think is about $1,200 or $1,300.
Just had one.
Yeah, doesn't go very far, but at least it helps a little bit, for sure.
Every little bit helps.
Yeah. Okay. Any other questions?
So any of the counties around us, do they have your insurance?
I think where I'm at. So Madison County, they're kind of close. They have dental and vision. Marr County, we're looking at possibly bringing them back into the trust. I'm working with them currently. Big Timber, which is Sweetgrass, they're kind of close. They are also interested. We're waiting to see what happens with some of the medical clinic employees. Are looking at, since Billings Clinic took them over, they're potentially moving those employees to the Billings Clinic health insurance instead of staying on the county. So that would affect their numbers as far as how many would be enrolled. So we're kind of in limbo until that decision is made, because if we provide them a medical proposal based on 100 employees and they only end up with 40 because those employees move, then that would affect the medical proposal. So we're kind of in limbo with them. We have Fergus County and Cascade County, and then, as I said, I'm working with Jefferson County for a 7/1 potential, bring them in effective 7/1 potentially. So that's kind of the closer ones, I should say. Lewis and Clark County, I'm still working with them. They're self-funded. They actually insure themselves, so that's a little bit different beast. But we are we're visiting with Eric and seeing if maybe they'd be interested in coming into the trust. And I'm thinking that as we move forward through this healthcare reform, it might not be a bad place to be as in the trust versus a standalone policy. And we did actually have some conversations with Missoula County during our MACO conference about a month ago. Some interesting conversation there, so I can't say that they're out of the realm either, and they are also self-funded. And they actually process their own claims in-house. They have an entire 8-man staff that processes claims. They have their own provider network, everything, so they're acting as their own insurance company as well.
They really are, aren't they?
Yeah, so we did have some conversation with them, and that might be an interesting piece moving forward too.
Well, and I think everybody's nervous because of the unknown. We don't know how this is gonna shake out.
Absolutely. Yeah, and being self-insured, there's a lot more taxes that you have to really be worrisome about. So I'm thinking that definitely might help push them towards some sort of insurance versus a self-insurance policy.
What I don't understand is how they say, if you don't have insurance, we're gonna fine you. The reason people don't take insurance is they don't have the money. So now you're gonna say, give me more money? That doesn't make sense to me. I think I'm missing something.
No, I don't, I mean, I'm right there with you, like, it's hard to be in this industry and see that sort of thing happen, because probably the reason they don't have insurance is because they can't afford it, and then they're getting these tax bills as well. So I think the idea of it is grand, but I definitely agree that there's some loopholes that affect the middle class. So I'm right there with you.
You know, the upper class, not a problem. The lower class, no, there's not a problem. The guys in the middle,
Yep, blue collar, middle class,
Mhm.
that's where the loopholes are really standing out, because you typically don't qualify for a subsidy, so the government's not helping you pay for those. You can't afford to insure your whole family on even an employer-sponsored plan. You know, it's really expensive. And some of our counties have family-friendly rates. Some counties have really family-friendly rates, and I believe, does a Teamsters offer, do you pay for the entire family on the plan covered?
Yeah,
That's huge,
yeah.
that's huge. But if an employee doesn't have that opportunity, it's really expensive to insure your family. So there again, we do tell a lot of people about Healthy Montana Kids. Those income guidelines have gone up to what I consider to be a fairly substantial income for a household of 2 or 3 people. So we do tell a lot of people about Healthy Montana Kids as an option to insure children. We do have a couple health insurance producers that I feel are in the best interest of the employees or their spouses that we recommend that they go to try and help navigate through the marketplace. And other than that, you know, it's just fine. So, yeah, it's a tough world right now out there.
like I said, I feel really bad for those people because they can't afford it. So we're gonna fine them.
Yep.
And how you gonna pay it, you know?
Typically, they'll take it out of their tax return. You know, some of those people might get a tax return, but if you don't, then you end up owing. So, I definitely agree with you. We'll see what happens when our new president takes, well, I'm assuming we'll have a new president. So, we'll see what happens and what kind of changes are made there. We can only hope for the best,
Mm-hmm.
definitely.
Shelley, you mentioned Sweetgrass County and Billings Clinic. Do they own a nursing home, or is there a public health clinic?
Yeah, it's a medical facility. That they
okay.
have.
That the county owns?
So the way that our trust document is written is that if you have a nursing home, a medical facility, or like a county health clinic, we can allow them to participate through the county as a
Okay.
sub-entity. So that's how they've been participating as county employees. Well, I should say as on the county's health insurance. And we would accept them as well. We do have some counties that have grandfathered sub-entities, if you would, such as Park County has a little group called Southwestern Chemical Dependency.
Yeah.
They're in no association with the county, however, they're grandfathered in, they participate in our health insurance through Park County. Because of that, we do have a few, like Missouri River Medical, some cemetery districts, irrigation districts. Some of those special districts we also allow on to participate through the county. So we do have that option available.
Okay,
Yeah,
oh, it's good to know.
yeah. And I said the cemetery districts as well. And a lot of them have their own budgets. They do not receive checks from the county, but again, because of the way our trust document is written, we allow them to come in through the county and participate as part of the county's numbers.
Good to know.
Yeah.
Yeah,
So, do you guys have a nursing home or medical facility county-owned in Bradwater County?
no, we own the building, we have a hospital district board, but the actual operations are separate.
Okay.
So it's, I think there's just a few of us with this structure.
Gotcha.
Yeah, So I don't know how that would work.
Yeah, we definitely could take a look at it. I'd have to call Harold in on that because he's the know-all of.
He's the guru.
He is, he's amazing. But he would take a look at the relationship and determine based on Montana law if it was applicable.
Okay,
Yeah, but we could definitely take a look at that
yeah,
for you.
Do you know who the hospital has for health insurance?
I don't. Uh-uh,
Made me wonder.
yeah. Yeah. No clue.
Yeah, so that's something we could look at if Broadwater County decided they wanted to look at the healthcare trust and possibly bring them on board as well.
How about city governments?
They're typically insured through MMIA, which
Okay.
is the city, same, just like Mako, but the cities.
Okay,
Most of them go through MMIA,
okay.
and we only allow the county and their sub-entities.
Do they have fire departments?
We do not.
But a fire district would work, right?
Well, possibly. Yeah, we don't have any. Again, I'd go to Harold on that. I would look to Harold for clarification for purposes on that. Maybe I'll ask him just
Yeah,
to ask. I wanna say there's something in there about fire where they have to have their own, but I'd have to get clarification on that,
okay,
definitely.
yeah. Doesn't hurt to brainstorm possibilities.
Yeah.
Yeah,
No.
Yeah, I'll definitely ask him about it
okay,
and see, and I can, departments versus districts. Okay, and I can send, do you want me to send it, Harold's response
that'd be
to
great.
you, Laura?
Yeah, and then I can forward it to these guys.
Okay,
Yeah, and Debbie.
yes, I will send it to both of you. Okay, I can do that.
All right. Anne, if you're curious.
Do you want me to include you on it?
She can,
Laura, okay,
she'll take care of it.
okay,
Yeah.
wonderful. I'll email it to you and Debbie, and then you can.
Perfect. Okay.
Grant, well, thank you very much.
Thanks for coming down.
Yeah, any other questions I can answer or look to Harold for?
Not that I can think of.
Okay, well,
No.
thank you very much for your time. And I'll
Thank
look
you.
forward to visiting with the insurance committee
Yeah,
when
Yeah.
that happens to be, and then hopefully if Elaine and Franklin, you guys can make it to the seminar next week, that'd be great.
So what does insurance cost, say, for a family, typically?
Through the healthcare trust?
Mhm.
So the way that the healthcare trust operates is we have an onboard actuary, and what we would do is take the past 3 years of claims utilization within Broadwater County, as well as your past 3 years of rate history and plan design, and a census so that we could look at demographics, and then our actuary computes all of that information and determines a pot of money that it would take to insure Broadwater County for the upcoming year, based on your last 3 years of utilization history. So every county is different. We can't say that there's just a flat $500 rate or anything, because it's all based on that pot of money, based on your individual claims utilization. So then what we can do is, once we have that pot of money that our actuary Dave has determined is applicable, then we take our plan benefit design, and Broadwater County would say, you know, we're interested in this one, and this one. You could offer potentially 2 to 3 different plans if you wanted to. And we would calculate that pot of money based on plan design, and that's how we would come up with the rates. So there are some plans in there that are less expensive than other plans, obviously higher deductibles, maybe a 70-30 co-insurance versus an 80-20, a little bit different plan design that way. So some of them are less expensive than others, and we would come up with those rates based on that pot of money. And then depending on what Broadwater County wanted to do, we could take our standardized tiers and modify those factors a little bit, so that, let's say, one plan was, let's just say $500 for ease of math. but you wanted to have more family-friendly rates, we would, we would add more money to that employee-only rate so that it would subsidize your family. So we would sort of falsely weight this. So if that rate was supposed